Dr. Harold Shipman, also known as Dr. Death, was a British general practitioner and one of the most prolific serial killers in history. He was convicted of murdering at least 15 of his patients, but the true number of his victims is believed to be much higher. Here's a complete overview of his story. Harold Frederick Shipman was born on January 14, 1946, in Nottingham, England. He pursued a career in medicine, earning his medical degree from Leeds School of Medicine in 1970. Shipman began working as a general practitioner, GP, in the town of Hyde, Greater Manchester, where he gained a reputation as a caring and attentive doctor. Over the years, Shipman established a successful practice and developed a close relationship with many of his patients, particularly elderly women. He was trusted by the community and often made house calls, which allowed him to build strong bonds with his patients and their families. However, Shipman's apparent kindness concealed a dark secret. He began administering lethal doses of prescription medications, particularly morphine and diamorphine, a powerful opiate, to his patients. He did so under the guise of providing pain relief, often forging medical records and death certificates to cover his tracks. Shipman's victims ranged in age and health status, but a significant number were elderly women. Suspicion about Shipman's activities grew when local undertakers noticed a high number of his patients dying at home, compared to other doctors' patients. In 1998, a fellow doctor became concerned about the high death rate associated with Shipman's patients and alerted the authorities. This led to an investigation into Shipman's practices. During the investigation, it was revealed that Shipman had intentionally killed patients over a period of many years. He was arrested in September 1998 and charged with 15 counts of murder and 1 count of forgery. In January 2000, Shipman went to trial, where he was found guilty on all charges. On January 31, 2000, he was sentenced to life imprisonment. The judge recommended that he never be released due to the heinous nature of his crimes. In a subsequent inquiry, it was estimated that Shipman may have been responsible for the deaths of over 200 patients. He was suspected of killing many more patients than he was officially charged with, but definitive proof was difficult to obtain in all cases. In prison, Shipman maintained his innocence and appealed his conviction. However, his appeals were unsuccessful. On January 13, 2004, just 1 day before his 58th birthday, Shipman was found dead in his prison cell. He had hanged himself using bed sheets. The case of Harold Shipman highlighted the vulnerability of patients under the care of trusted medical professionals and the challenges of detecting healthcare-related serial killings. It also prompted significant changes in medical regulations and oversight in the UK to prevent similar incidents in the future.